Hello, everyone. Thank you so much for helping me. It's another session. If you're new, you've not seen me before. My name is Ransom Nyema. I'm a third year medical student studying medical radiography in my third year, and I'm based in Nigeria. I'm studying at Federal University of Technology School of Basic Medicine, and today I have an amazing guest speaker. Hey, Kim, could you introduce yourself to the audience?
Sure. Hi, Ransom. Thank you very much for having me. Yeah, my name is Kim Downey, and by training, I'm a physical therapist. Most of my work was with pediatrics. And then I recently, over the past few years, had cancer several times with several surgeries and radiation treatments. And my radiologist had died. And since then, addressing physician wellness has become my life's purpose. And that's what I've been doing as I try to find ways to support physicians.
That's amazing. That's amazing, Kim. So this session is going to be majorly about how you navigated through cancer. So if you don't know, she's a cancer survivor and she's a very strong woman, to survive cancer. So tell us a little bit about the work you're doing right now before we proceed to the next question.
Sure. So, did you want me to speak to the work I'm doing? Did you say the work I'm doing, or something about the cancer? I wasn't sure. I didn't
Yeah,
hear.
yeah, the work.
Sorry.
The work, yeah. What you're
Oh,
doing right now.
Oh, sure. So, basically, I spent a lot of time on LinkedIn, connecting with physicians, communicating with physicians, supporting their work, supporting their posts. Sometimes we'll reach out to each other, and they're interested in having a conversation. So then we either talk on the phone or we Zoom. And I've recently started a YouTube channel called Stand Up for Doctors, where I interview physicians and also others that intersect with healthcare. I've had on one patient so far, and that's how I have the four doctors. So the stand up doctors is when I'm interviewing the doctors, I want them to stand up and raise their voices, right? So we can make things better. And then the four part is when I'm interviewing patients, that we all need to stand up for doctors because everyone wins when physicians are well. Dr. Kathy Stepien has said that, and I've quoted her multiple times. And we need to care for our caregivers. We need to take care of them so they can take care of us, and try to change things in the system to make it better with less obstacles.
Absolutely. I really love what you're doing, to be the voice of the voiceless. And that's really amazing, Kim. Really amazing. So talk us through, take your time, talk us through how the cancer came about and how you survived it and how you got in contact with your radiologist that died a few years ago.
Okay, sure. So I had thyroid cancer, and in November 2020, I had surgery and I had my thyroid removed. And during the surgery, three of my parathyroids were inadvertently removed, and the fourth one never kicked in. And that caused a series of complications with calcium regulation and kidney function. So I started to see a nephrologist, and the next summer with my physicians, we were still working on, regulating my calcium. And I blacked out and fell and hit my head. And turns out I had Lyme disease, a concussion, thoracic outlet syndrome, a whiplash injury, and a broken toe. So I went through 4 months of physical therapy. I had an amazing physical therapist who thinks outside the box. I had neck issues and dizziness, and we weren't sure what was from the concussion or what was from the Lyme disease because I had never had either one before. But he had me in good shape by December 29th, that year. And but the very next day I was back on the operating table because we had just found out that I had breast cancer. So that day before the surgery was when I met my radiologist, and the tumor had been very small. In the metal clip that had been inserted to mark the tumor site had gotten displaced, and it was my breast surgeon later said it was like looking for a needle in a haystack. So the day that the radiologist had to insert the magnetic clip, he got it in the exact spot, and he said it was the most difficult mag-C placement he had ever performed in his 30 years as a breast radiologist. And so I had that surgery and a course of radiation, and I had also had a course of radiation for the thyroid cancer because the anterior margin had been positive. And after that, I needed another MRI, which found cancer on the other side, breast cancer. So then I needed another surgery and course of radiation. And the day before that surgery, when I saw the same radiologist again, he had gotten the magnetic clip to pierce the metal clip, which never happens. It's like radiology Olympics. And my breast surgeon later said about that, he said it's like threading a needle when you can't even see the needle. So he was incredible. And I sent him and my breast surgeon both times a thank you note. And then my radiologist had called me that summer when I was sitting at the beach to thank me for my thank you note. And then that fall, what I thought was finally going to be a routine visit to his office for a mammogram and ultrasound. And I got there and I asked where he was, and they said he had died a month ago, and I couldn't even believe it. And I asked what happened, and they said they didn't know. And I was just so shocked and devastated. And I just have felt a calling. I don't know how else to describe it. That I felt called to support physicians. And so that's how I started doing what I'm doing.
Now, well, Kim, listening to your story about all things related to how you survived cancer is really, really encouraging. You know, because you're a very, very strong woman. You know, and so I want to tell you something. You know, cancer is really paramount. You know, paramount in our country. You know, like globally, and so there are stages in cancer, and people might watch this video and you know they're suffering from different types of diseases or something, or you know all kinds of diseased problems. You know, so what are your advice for people that are suffering from cancer right now?
Well, it's important to have physicians that you can trust. And there's certainly, I'm lucky to live in the Northeast in the United States where we have a lot of physicians. And so it's important for you to be honest, with your doctors and other healthcare professionals about how you're feeling and ask the questions to make sure that you have your questions answered, to be sure that you're comfortable with the treatments you're going to be receiving. And if you're going to have surgery, to make sure that you have what would call a true informed consent and make sure that you understand all the risks associated with the procedure and say, is this everything? Or if they tell you something and you don't understand what that risk is, ask them to explain it. And just really, and then also in respect, it's a two-way street, that you need to show your doctors and other healthcare providers respect as well, and then you should expect respect in return.
Mhm. That was an amazing you know nuggets you shared to people that are faced with cancer, and so I really love your work, Kim, about you being a healthcare advocate. You know, you talk about like you say you own a YouTube channel where you interrogate with doctors and patients, for them to talk, be the voice of the voiceless, and that's amazing. You know, making the audience really, enlightened based on things related to healthcare and medicine in general. So I want to learn something from you. What triggered you to do what you're doing? Like what made you to start up a YouTube channel based
Uh-huh.
on that based on that niche, and what are you trying to achieve in the nearest future?
Right. So, I feel like, and other people have said the same, that I have a unique perspective in that since I was a physical therapist for 30 years, that I have a good understanding of the struggles that healthcare professionals are facing, in the climate, in the current healthcare climate. So I fully understand that, and I lived it. And then also having had cancer 3 times, and I had seen a total of 37 doctors, even if it was one test, one procedure, because my 3 surgeries were 3 different hospitals, 2 different states, and for a lot of different reasons. So I've had a lot of experiences as a patient. I almost feel like you could call me like a professional patient, right? So I feel like having that, like a full perspective, and of having all experiences as a patient, from wonderful experiences to experiences I would describe as traumatic. So since I understand all of those things, I feel like I can, raise my voice, and also bring together patients and physicians, because we all need to tell our stories. And I feel like that's what I'm doing with the YouTube channel. So specifically, a lot of the work, or I could say all of the work that I'm doing, is I've been guided by my wonderful physician coach, Dr. Michael Hirsch. And he was the one who had suggested, when I was feeling low about the death of my radiologist, he said, why don't you write something down? And after I wrote something down, he said, that's really good. You should submit it to Kevin MD. So long story short, now I've had at least 13 pieces accepted by Kevin MD, and now all are collaborations with physicians after the first 4. And I've done multiple podcasts, so I appreciate his platform. And I feel like it's so important that we are showing that doctors and patients can work together and share our stories together. And then, so that's what I do on, my YouTube channel, is I've been spotlighting physicians. And as time goes on, after the next maybe month or so, I'm going to try to double up and have either 2 doctors or a doctor and a patient, on together. So I'm still getting my feet wet, but
Also, that is incredible, Kim. That's really incredible. So I want to learn something from you before we wrap up the session. So what are the challenges you're facing right now, and how are you intending to conquer such challenges? To tell us.
well, that's a very, very good question, Ransom. And people ask me what I'm building or what I'm doing. And I tell them that I simultaneously know and don't know. And I know in that every day I have long lists of things to do, like, and, and whether it's giving people shout outs after we have a conversation, to publishing podcast episodes, to Zooming, with physicians. So my schedule is full every day and I know what to do. But since I didn't plan on doing any of this, uh and what I want to do is make an impact, so I'm trying to do that both locally and on a broader basis. So locally, I would love to find ways to support my own physicians and to do something for them. So I recently gave a talk to my friend, Parkinson's group. She's in New Jersey, and it was a virtual talk, and it was based on the Kevin MD article I did with Dr. Don Sears, called 10 Things to Know About Your Doctor That'll Get You Better Care. So we spoke to patients, about things that they can do when they're having visits with their physicians. And and I would like to replicate that talk here in my own town, possibly for at our cancer support center, or give a talk at our library. And I'm trying to find some local patient collaborators who might have other ideas as well, is how we can try to make a difference, right here, where I live in Connecticut. And then some things, though, we know need to be broader, more systemic changes. So I'm actually working with Medicine Forward. It's a national organization here in the States. And I'm their community ambassador. And we're finding ways that we can make a difference, how we can move the needle as well.
That's incredible, and I love the fact that you're doing all those things you're doing. But in my country, Nigeria, cancer is really paramount. It's really everywhere in my country. So I think you should reconsider going over to Africa. What do you think about that?
Well, I don't know. I have a friend who took a trip there and she said it was an amazing experience. So if she goes back, I just might have to go with her.
You have to, especially in Nigeria. You have to come over here and know how things work. But I'm based here, so I'm gonna tell you little things about it. Cancer is really people. One thing about Africans are we are really lackadaisical based on things related to medical aspect. We don't really go to hospital to do checkups and all stuff. We don't need to because we have doctors everywhere. Parents are really now doctors. They can prescribe drugs to the children without the doctor's permission or something, and
Mhm,
that's really dangerous because every drug. I did pharmacology in my second year in
mhm,
med school, and that course really opened my eyes on things related to drug and how we use it. Drug abuse is not about taking overdose or the action to take two to four. That's not only a drug abuse. If you take a drug without doctor's prescription,
mhm,
it's escalated to what's called drug abuse. So
mhm.
it's better that if you're feeling uncomfortable, if you're feeling ill or something, go see a doctor, do a test and all sorts of things. So I think if you set up some foundations here in Nigeria, it's gonna be a really helpful thing to be.
Mhm, mhm.
Yeah.
Yeah, no, that sounds terrific, and thank you for all the work that you're doing, raising voices of other people
Yeah.
and getting yourself out there, right? And so that's part of it is again us sharing our stories even in other countries and around the world.
Yeah, absolutely, absolutely. Did you think your environment is really an addition in the kind of work you do, or is it a disadvantage? Tell us.
From what perspective? What do you mean my
Like
environment?
when you talk about the cultural diversity, how does it work incline with the work you do?
Well, you know what? I think that again, it comes back to sharing our stories because what I've been hearing from, some physicians is sometimes, women, we still don't have full equality here. Like men make more than women do for doing the same job. Women feel like they have to prove themselves over and over again. So that's from a professional or physician standpoint. And from a patient standpoint, a lot of, women especially that they've shared with me if they're around middle age and if they're somewhat overweight frequently feel dismissed by their doctors, by their physicians. Like they might say, well, just lose weight, or oh, it's expected because you're 50 years old or something like that.
Yeah,
And
yeah.
even culturally, I black physicians or physicians of color, sometimes and women physicians. Dr. Don Sears and I discussed this a bit in our article and in our private conversation, that when they walk into a room, people aren't always willing to acknowledge them or assume that they're the doctor. They actually assume that they're not the doctor. So we need that respect, and that basically, if you don't know, ask, right? And also, and that the professional should, of course, be introducing themselves. But we need to respect, no matter your, race, gender, age, creed. If you're the doctor, you're the doctor.
Absolutely. Okay, so the last question goes to say, you've interrogated with a lot of patients and a lot of doctors. So tell us what are the things you've learned from their story. You need to share to the people out there to learn. So about the patient, what are the things, the core values you've learned, about their stories and all such, so that people can get enlightened based on that.
Well, as a patient, what I've learned even more about physicians is that everybody needs to know that they're human. And you would think, well, of course they're human, right? But on my YouTube channel, about at least half of the doctors, when I say, what would you like our audience to know about you? At some point during the conversation, they actually say that I'm a human too. I have human wants, human needs, and we spoke to that in our article. Again, Dr. Don Sears and I, she says, we're humans, we need to, eat, sleep, go to the bathroom, spend time with our children. Because my friend had said a quote that really is stuck with me, that she said she feels like I'm giving a voice to doctors who feel like they have to be superhuman, or that they're perceived as superhuman because of their salaries, and that a lot of people don't have empathy for them because they think a doctor's life would be the ultimate.
Absolutely, yeah, it's true. It's true. They think the doctor has made everything, so that you don't need to worry about anything. It's true. They're humans too. Thank you for putting that out.
And they
Yeah,
have
absolutely.
all the same issues, that we have, right? They're,
Hmm.
like I said, their kids get sick. They want to go on vacation. They have leaky roofs. They have insurance troubles, right? They might get a flat tire on the way to work.
Yeah, yeah, absolutely. They have a lot of problems to face, and they might have a patient died, and it
Right,
can
on top
affect
of,
the
right.
mental health.
Exactly. Things
Absolutely,
are difficult enough. Right, exactly.
absolutely. So, before we wrap up the session, what are your last words for the audience, Kim?
Oh, well, let's see. Well, again, thank you, Ransom, just for having me on there. And basically, to move the needle in healthcare, we all have to care about each other. So I think if we all share our stories together, and we all really listen to each other, and all try to make it come together and try to make a difference together, that's what's going to happen, because we are the system, right? When we say the system, the healthcare system, it's people, it's us.
Absolutely, absolutely, absolutely. Thank you so much, Kim. You've been an amazing, amazing guest speaker, and I believe that you shared your story, which is very amazing. And I believe that the audience will really learn something off it. And if you love this video, do well to share, subscribe, and comment, and share to your network. Hopefully, this video is going to help someone. Thank you so much, Kim.
Okay, thank you, Ransom. You have a good day.
You too. I'm ending it right now.